meeting is being recorded.
A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. R.K. BISHWAS sir. So, sir is a renowned personality from the State Lalbahadur Shastri Homeopathy Medical College, Prayagraj. And sir has completed MD and PhD and MSc Microbiology. And currently, sir is a professor and HOD of Department of Pathology. Coming on to the today's topic. So, sir will be taking regarding the cerebrovascular accident and its importance in the homeopathy and how to deal with in homeopathy. So, we welcome you, sir. We welcome you all the participants. Session is all over to you, sir.
Good evening. Myself, Dr. R.K. BISHWAS. At first, I am thankful to AIHSAYA, All India Homeopathic and Youth Association, and Homeovision for giving me opportunity to conduct this webinar as a speaker. This webinar series is really helpful for the students, candidates, and participants for enhancing his knowledge and improvement and further education. So today our topic is cerebrovascular accident. Just like a heart attack, stroke is a critical condition, need emergency care. There is some limitations in these cases. As a homeopathic physician in homeopathic treatment, it is an emergency condition. So it needs emergency interventions, and in recovery period, we can treat with the homeopathic medicines. In initial condition, we have to refer the patient to the hospital and give emergency care. Definition: a cerebrovascular accident is an ischemic attack of the brain tissues and ultimately an infarction of the brain tissue caused by an interruption in cerebral blood flow. This results from damage to an artery supplying blood to the brain. Ischemia to the brain tissues lasting 5 minutes or less will cause permanent damage because neural tissue is incapable to regeneration. It means there is no regeneration in the brain tissue. If blood supply ceases for 4 minutes or 5 minutes, it will lead to the permanent damage of the brain and lead to the functional damage to the brain. And sometimes if these factors are more severe, may cause death of the brain. Cerebrovascular accident results from the ischemia to the part of the brain or through the hemorrhage. It may be acute, it may be gradual. When it is due to the hemorrhagic cause, it is sudden or acute, or sometimes it due to the ischemia, some thrombosis, some embolic cause, it may be produced as gradually. Hemorrhage or this ischemia into the brain result death of the brain cells also. Approximately cases 750,000 reported annually. Third most common cause of the death in the world. First leading cause of disability, because some patients are survived after the stroke. They living their remaining whole life with permanent disability or some kind of disability like paralysis or paresis or hemiplegia, etc. 25% cases with initial stroke die within 1 year. 50 to 75% cases will be functionally independent. 25% will live the permanent disability. Physical, cognitive, emotional, and financial impact also produced the patient as well as his family. The statistics: 1 lakh to 1,50,000 pupils C.V.A. per year in the India, and 7 lakhs death per year through the C.V.A. or its complication per year. 30% die in acute stages and 30 to 40% are severely damaged, and remaining life of this patient lives with this disability. Cerebrovascular accident risk factors is occurrence doubles each decade. After the 55 years of the age, gender equally it affects the men and women. Women die more frequently than the men. There is African Americans, Hispanics, Native Americans, Asian Americans, high incidence suffering from the C.V.A. Hereditary family history, prior transient ischemic attack or prior stroke increases. If there is family history of stroke or transient ischemic attack in the parents or in grandparents. So increased risk maybe increases. Other risks are controllable risk with the medical treatment or lifestyle changes, because sometimes the stroke comes suddenly, but previously warning signs are there, like through the transient ischemic attack or some kind of paralysis like symptoms or numbness like symptoms. If we change our lifestyle or take some medications, so it may be controllable. Controllable risk factors: high blood pressure, hypertension. Majority of the cases of stroke having previous history of the hypertension as well as diabetes mellitus. Cigarette smoking, high blood cholesterol. If LDL level is high or serum cholesterol level or triglycerides high, there is chances maybe increases of the stroke. Heart diseases, oral contraceptive uses, sickle cell disease, hypercoagulability of the blood. If blood is viscosity of the blood is high, excess of vitamin K, or blood may be hypercoagulable, so chances of the thrombosis, embolism, thromboembolism may be increases. Diabetes, aspirin, obesity, atrial fibrillation, physical inactivity, asymptomatic carotid stenosis disease. These are the factors. Patient is in risk factors. High blood pressure, high cholesterol, and diabetes mellitus. These three factors, if they are overlapping or two or more than two factors present in a patient, there's chances of the C.V.A. increases. Cerebrovascular accident, anatomy of the cerebral circulation, blood supply. Take a look at the blood supply of the brain. Anterior carotid arteries, middle and anterior cerebral arteries. It supplies the frontal, parietal, temporal lobes, basal ganglion, part of the diencephalon, thalamus and hypothalamus. Posterior, it may be vertebral artery supplies the basilar artery, mid and lower temporary or occipital lobes, cerebrum, brainstem, and part of the diencephalon. Circle of Willis connects the anterior and posterior cerebral circulation. Blood supply: 20% of the cardiac output, maybe 750 or 100 ml per minute. More than 30 seconds interruption, neurological metabolism is altered. Metabolism stops in the 2 minutes and brings cell death if blood supply ceases 4 or 5 minutes or more than this. This is the diagrammatic presentation supply of the brain. Major types of the stroke: thrombotic stroke, embolic stroke, or hemorrhagic stroke. Thrombotic stroke may be due to the hypercoagulability blood, history of the smoking, and severe factors, blood clotting excess. It may be causes embolism, thromboembolism. These both causes, thrombotic and embolic, produce gradual development of the cerebrovascular accident or paralysis type of symptoms. Third one is hemorrhagic. Hemorrhagic may produce sudden onset of this type of symptoms, paralysis or stroke, due to the sudden rupture of the cerebral vessels. Pathophysiology: atherosclerosis, major cause of the C.V.A., thrombus formation and emboli development, abnormal filtration of the lipids in the intimal layer of the arterial wall, plaques develop, and location of increased turbulence of the blood at the bifurcation. If blood is more static or slowing of the blood stream, or blood supply may be turbulent, as in hypertension, they produce more effect at near the bifurcation of the vessels. Increased turbulence of the blood or the area of tortuosity, where aneurysm may be developed or blood vessels has become tortuous. Calcified plaques, ruptures or fissures. Platelets and fibrin adherent to the plaques and produce increases the size of this plaque and atheroma. Narrowing or blockage of an artery by the thrombus or emboli. Cerebral infarction, the blocked artery with the blood supply cut off beyond the blockages and produce severe effects. My voice is clear? Am I audible? Yes or no? Hello?
Yes, sir. Yes, sir. Audible, sir. Please keep
Okay. Okay. Pathophysiology: the ischemic cause, series of the metabolic events, inadequate ATP adenosine triphosphate production, loss of iron, hemostasis, release of the excitatory amino acids, especially glutamate, free radical formation, and cell death. These factors affect, especially in the ischemic causes. Border zone, reversible area that surrounds the core, ischemic area in which there is reduced blood supply, but which can be restored in the 3 hours or less than 3 hours. Other warning signs are sudden numbness and weakness of the face, arm, and legs, especially on the one side of the body, because before the gradual attack, it produces some warning sign and symptoms. It may be transient, it may be last for few minutes or few seconds, but the patient can feel the numbness, unilateral, bilateral, or sometimes in both extremities. This is the warning sign. Sudden confusion and troubling on the speaking and understanding speech, because at the time of stroke there is some kind of nausea is there. The patient unable to protrude the tongue outside, unable to raise the hand, and sometimes the vocal problems are also there. Patient unable to articulate the word also, and doesn't complete the complete symptom. So these are the signs symptoms produced at the time of stroke, and we can differentiate it other pathological conditions also. Sudden trouble seeing in one or both eyes. There is disturbance in the accommodation problem, or in visual problems are also there. Sudden trouble in the walking, dizziness, and loss of the balance and coordination. If patient going to upstairs and sometimes walking at the area or garden, patient unable losses his control and sometimes fall down on the ground also. And sometimes there is dizziness, darkness, and cloudiness feels, and sometimes patient feels that all around surroundings are dark and balance is lost, or patient fall down. Sudden severe headache with no non-cause. TIA, transient ischemic attack. This is a temporary condition. It is a phasic condition, lasts for a few seconds to a few minutes. This is temporary focal loss of the neural functions. Patient sometimes become unconscious for a few seconds, facing some paralytic-like symptoms, hemiplegia-like symptoms for a few seconds, caused by the ischemia of one or of the vascular territories of the brain. Microemboli with the temporary blockage of the blood flow, lasts for less than 24 seconds, few minutes to seconds to few minutes to 24 hours also, but oftenly less than 15 minutes. More resolved within the 3 hours. Warning signs is progressive cerebrovascular disease. If patient suffering from some kind of other disease, cerebrovascular disease, some kind of thrombotic disease or hypercoagulability of the blood, its symptoms may be severe. Transient ischemic attack, diagnosis by the CT without contrast, confirmed with the transient ischemic is not related with the brain lesions. Cardiac evaluation, rule out the cardiac mural thrombus. Treatment, medication given, the platelet for the platelet aggregation, anticoagulants, some thrombolytic medications also given to these conditions. Classifications based on the underlying pathological findings. Classification: ischemic stroke or hemorrhagic stroke. Two basic type of stroke. Ischemic strokes are thrombotic or embolytic. Hemorrhagic stroke may be due to the intracerebral hemorrhage, sudden hemorrhage or sudden rupture of the cerebral vessels, or subarachnoid hemorrhage. Maybe aneurysm, or due to the berry or secular type of aneurysm. It may be tortuous, and sometimes this swelling protrude in the one side, or aneurysm, the soft part of the aneurysm may be ruptured and sudden bleeding is there. Ischemic stroke, inadequate blood flow to the brain from partial or complete occlusion of an artery. 85% of the all strokes. Extent to an stroke dependent on the extent of the stroke depends on the rapidity of the onset, size of the lesion, presence of the collateral circulation. If there is development of the collateral circulation and sudden this supply may be rehabilitated, the effect of the stroke may be less. Sometimes rapidity of the onset, as the fast of the rapidity development for the stroke, sudden or acute stroke produce the more severe symptoms. It lasts for a long period, and this type of lesion may be last for severe hours, for 4 or 5 hours. The symptoms are more severe, and survival of the patient is difficult. Symptoms may progress in the first 72 hours, and infarction and cerebral edema may be increases. Type of the ischemic stroke may be embolic, may be thrombotic. 3 major signs for the recognition of the stroke. आप पेशेंट को इन 3 साइन से रिकॉग्नाइज कर सकते हो कि पेशेंट इज सफरिंग फ्रॉम स्ट्रोक और नॉट, बिकॉज अनकॉन्शियसनेस आना, गिर जाना, ट्रेम्बलिंग होना, गिडीनेस, डिजीनेस, ये कई डिजीज में होता है. आस्क द पेशेंट टू द स्माइल एंड स्टिक आउट द टंग. पेशेंट को अगर स्माइल करने के लिए और एक साइड में टंग को हम कहेंगे आराम से प्रोट्रूड करो, तो patient is unable to produce the tongue. Ask the person to make complete sentence. There is definitely difficulty in the articulation of the words. If we ask the patient to make a complete sentence, then patient unable to complete this sentence smoothly. Ask the person to raise both hands. At the time of stroke, very difficult for the patient to raise the hands. अगर तीनों symptoms present है इस तरह के या दो symptoms present है, that condition may be give the indication the patient suffering from the stroke. Movement of the blood vessels narrow in the thrombotic stroke, then become occluded and produce the symptoms of the infarction. Associated with the hypertension and diabetes mellitus, more than 60% of the stroke, 50% are preceded by the transient ischemic attack. Lacunar stroke, development of the cavity in the place of the infarcted brain tissues. Sometimes there is infarct area is soft and oedematous, and tissues may be sometimes degraded or damaged. It produces small lacuna or lake-like symptoms. It produces the symptoms of lacunar stroke, resulting in the considerable deficit motor hemiplegia, contralateral loss of the sensation of the motor ability. These symptoms may be produced. Thrombotic stroke, you can see the histological picture. Cerebral thrombosis, the narrowing of the arteries by the fatty deposition of the plaques. Clot also formed and to the arteries. This is the CT image, ischemic area of the brain. You can see the ischemic area become soft, oedematous, pale or white, clearly seen in the image of brain. Common site of the atherosclerosis, आप देख सकते हो. This is the sites: left subclavian artery, innominate artery at the bifurcation of arteries, left to right, suman carotid arteries, external carotid arteries, or subclavian arteries. These are images. Embolic stroke. Embolus lodges in and occlude a cerebral artery, resulting in infarction and cerebral edema of the area supplied by the vessels. Second most common cause of the stroke, approximate 20%, 4% of the cases. Emboli originate in endocardial layer of the heart, arterial fibrillation, MI, infective endocarditis, rheumatic heart disease, and valvular prosthetic valve disease. Rapid occurrence with the severe symptoms. Body does not have time to develop collateral circulation. It may be developed in any age group, and recurrence common in underlying cause are not treated in the embolic causes. The embolism, whatever the nature of the embolism, if cause is not treated, it may be fat, it may be thromboembolism, it may be other substance. If it not treated, it may produce the recurrence and repeated attack of the stroke. Histologically, the embolic stroke, you can see an embolus is a blood clot or other debris occluded in the blood vessels, reaches the arteries of the brain and causes the narrowness of arteries. Goals of the management. क्या हमारे एम क्या है, तुरंत इसको क्या चीजें हमने जो है कंट्रोल करनी है. इमीडिएट एक्सेस एंड स्टेबलाइज. एज, ब्लड प्रेशर, इनिशियल द वाइटल साइंस जो है हमने कंट्रोल करने हैं. वो देखना है पेशेंट की एज क्या है, ज्यादा एज है, यंग एज में हुआ है, ब्लड प्रेशर अगर बहुत ज्यादा शूट कर गया है उसको कंट्रोल करना. क्लिनिकल साइन एंड सिम्टम्स को हमने देखना है. ड्यूरेशन ऑफ द ट्रांजिएंट इस्केमिक अटैक, हिस्ट्री ऑफ द डायबिटीज एंड TIA की हिस्ट्री हम देखते हैं कितने टाइम से है. न्यूरोलॉजिकल स्क्रीनिंग करेंगे. ऑक्सीजन, इफ हाइपोक्सिक है, गिव द ऑक्सीजन सपोर्ट. चेक द ग्लूकोज लेवल. पेशेंट इफ इज हाइपोग्लाइसेमिक, गिव द ग्लूकोज. Because sometimes diabetic patient may go to the hypoglycemic attack also. That condition, we have to give some glucose. Activate the stroke team for the emergency care. Immediate neuro assessment. Establish the symptoms, onset, review the hypoxia, stroke scale, facial drop, arm drift, abnormal speech. Note the all three symptoms, clinical sign symptoms of the, and try to treat immediately. CT scan, no hemorrhage, considered fibrolytic therapy. अगर कोई हमें नजर नहीं आ रहा है क्लोट और हमें लग रहा है कोई थ्रोम्बोटिक कॉज हो सकता है तो इमीडिएटली हमें फाइब्रोलाइटिक ट्रीटमेंट देना है, थ्रोम्बोकाइनेज या स्ट्रेप्टोकाइनेज. Check the exclusive, no anticoagulants or antiplatelet therapy for the 24 hours. If not, a candidate antiplatelet therapy may be given. CT scan, in the case of hemorrhagic cause, neurosurgery is there. क्योंकि अगर ब्रेन हेमरेज हुई है, cerebral artery rupture हुई है और external injury नहीं है, that is more fatal and more dangerous sign and symptom at the case of C.V.A. So immediately shifted to the neurosurgery department. Neurosurgeon should take the adequate decision. If no surgery, the stroke unit may be activated, monitoring the blood pressure, treat the hypertension, monitoring the continuously to the neuro status, and monitor the blood glucose and treat as needed. Also, supportive therapy may be given. Hemorrhagic stroke 15% of the all stroke. Ischemic 85% causes, 15% hemorrhagic strokes are given. Result from the bleeding into the brain tissues itself. It may be intracerebral or the subarachnoid. Intracerebral hemorrhage, rupture of the blood vessels. The main cause is rupture of blood vessels. Some aneurysm, aneuritic sports, weakness of the arteries. Many causes are there. Hypertension, if blood flow is turbulent and it produces external lateral pressure to the vessel wall, so sometimes weak point of the arteries may be ruptured. It is very important cause. So it is very important to control the hypertension. Other vascular malformation, coagulation disorders, anticoagulation, trauma, brain tumors, rupture, aneurysm. Sudden onset of symptoms with the progression, neurological deficit, headache, nausea, vomiting, decreased level of the consciousness, and hypertension. Prognosis very poor. 50% of the die within 1 week, and if they survive, 20% functionally disabled for the 6 months, and few persons rest of the life with the permanent disability. Hemorrhagic stroke or subarachnoid hemorrhage, intracranial bleeding into the cerebrospinal fluid, filled space between the arachnoid space and pyometer and membrane and surface of the brain. It adherent firmly with the brain, commonly cause the rupture of the subarachnoid hemorrhage, may be causes common to the rupture of the cerebral aneurysm, cognitive or acquired secular or berry aneurysm at the point where the aneuritic sport may be protrude, and this point is the weak point of the aneurysm. It may be ruptured. Sometimes the size may be enlarged. Majority of the cases, it is found near the surface of Willis. Other causes, anterior venous malformation, it is also a weak point. Trauma, illicit drug abuse, incidence 6 to 16 in 10,000 cases. Increases with the age and more common in the women. If there is history of the smoking, diabetes, hypertension, in old age, arteries are become some weakness is there or maybe fragile. There is chances of cerebral hemorrhage. Maybe chronic case of the hypertension, if it shoots out suddenly, it may cause cerebral hemorrhage. And head injury, road accident, fall from the bike, car accident. This is the major cause of head injury. It may causes cerebral hemorrhage also. Cerebral aneurysm, warning symptoms, sudden onset of the severe headache, worst headache in one's life. कभी-कभी जब रप्चर होती है ब्लड वेसल्स तो इनिशियल सिम्टम्स आया कि severe headache जब कोई एन्यूरिज्म रप्चर होता है. Neurological deficit, nausea, vomiting, seizures, stiff neck. Despite improvements in surgical techniques, many patients die or left with significant cognitive difficulties. Aneurysm, you can see the berry aneurysm, that is protruded area, weak area of the aneurysm, and sometimes it fills with the coils. A time comes, the aneurysm may be ruptured and sudden acute hemorrhage of the cerebral vessels may be seen. It is emergency condition, acute surgical condition. We have to shift the patient to the nearest neurological ICU centers, the neurosurgeon or neurophysician. Surgical treatment, clipping of the aneurysm, prevent and rebuild, prevent the rebleeding, recoiling, platinum coil inserted in the lumen of the aneurysm to occlude the sac. इसको हम बाइंडिंग थेरेपी कहते हैं, coiling थेरेपी कहते हैं. इसको बांध दिया जाता है, टाइट कर दिया जाता है. Post-op vasospasm prevention, calcium channel blockers may be given to the patient. You can see there is bandages or coiling therapy of the aneurysm for the prevention of the recurrency of rupture of this part, or medical clip may be causes, and wiring therapy, it is also coiling therapy may be useful for the recurrency of this kind of symptoms. Middle cerebral artery involvement in the clinical symptoms, contralateral weakness, hemiparesis, hemiplegia, contralateral hemianesthesia, loss of the proprioceptions, fine touch, localization, dominant hemisphere produce the aphasia, यानी कि बोला नहीं जाता है, and very difficult to खाया भी नहीं जाता है, और dysarthria also there. Non-dominant hemispheres, neglect the opposite side, and anosoglosia, unaware and denial of the neuro deficit. Homonymous hemianopia, defective vision and blindness, right or left half of the visual field or both, एक साइड से दिखना या आधा दिखना, विजुअल डिफेक्ट्स, ये सब इसमें सिम्टम्स इनिशियली देखे जा सकते हैं. Anterior cerebral artery involvement, brain stem occlusion, contralateral weakness or proximal upper extremity, sensory and motor deficient of the lower extremity, urinary incontinence, sensory loss, discrimination, proprioceptions, contralateral grasp and sucking reflexes may be present. Apraxia means loss of the ability to carry out the familiar purposeful movements in absence of the sensory and motor impairment. Personality changes, flat effect, loss of the spontaneity, loss of the interest in the surroundings, and cognitive impairment is also present. Posterior cerebral artery and vertebrovascular involvement अगर हो तो unilateral and lateral sensory loss may be seen. Contralateral and bilateral weaknesses, dysarthria, impaired speech articulation, वर्ड से वर्ड को जोड़ नहीं पाते, क्या कहना है वो कह नहीं पाते प्रॉपर्ली. Dysphagia, difficult swallowing, hoarseness, ataxia, बैलेंस नहीं बनता बॉडी के अंदर, vertigo is there, unilateral hearing loss, visual disturbances, blindness, myopia, nystagmus, diplopia and homonymous, मतलब कभी आधा दिखता है, कभी complete blindness, कभी to and fro movement of the eye, कभी कभी doubling of the vision may be seen. Motor function impairment caused by the destruction of the motor neurons in the pyramidal pathway, brain to the spinal cord. So it causes weakness of the muscles also. Mobility is defective. Respiratory functions may be affected. Swallowing and the speech may be affected. Gag reflexes poor, and self-care activities are also affected. Left-sided cerebrovascular accident may produce symptoms. So right-sided, due to the cross tract. लेफ्ट-साइडेड सीवी होगा तो सिम्टम्स क्या होंगे? पैरालाइज्ड राइट साइड हेमिप्लेजिया, impaired speech and languages, slow performances, visual field defect जैसे डिप्लोपिया, हेमियोपिया, आधा दिखना, डार्कनेस रहना, aware of deficits, depressions and anxiety, impaired comprehensive functions. So left side of brain damage, right side of body become weak. That is the sign. राइट साइड का अगर सीवी होगा तो इफेक्ट इसका लेफ्ट साइड में आएगा, क्योंकि लेफ्ट साइड बॉडी वीकनेस इसमें देखी जाएगी. पैरालाइज्ड लेफ्ट साइड हेमिप्लेजिया, स्पेशियल परसेप्चुअल deficits and tends to the minimize problems, short attention span, visual field deficit, impaired judgment, impulsive, impaired time conception. These are the symptoms of right-sided CVA. Clinical manifestations affect difficulty control the emotions, difficult to control the emotions, exaggeration and the unpredictable emotion responses. Exaggerated यानी भरे हुए, बहुत ज्यादा excessive, exaggerated, impaired, unpredictable, क्या इमोशनल रिस्पॉन्स हो, एकदम से इंपल्सिव हो, एकदम से sluggish हो जाना, ये सब रिस्पॉन्सेस देखे जाते हैं. डिप्रेशन, फीलिंग द रिगार्डिंग changed body image and loss of the functions may be seen. Intellectual functions may be affected, memory and judgment functions. Left brain stroke causes continues in the making judgments. Right brain stroke causes making the patient impulsive and more quickly to the decision, यानी कि बहुत ज्यादा हाइपर एक्टिव, एक्सेलरेटेड हो जाता है राइट साइड स्ट्रोक के अंदर. डिफिकल्टीज इन द लर्निंग न्यू स्किल्स आल्सो. क्लिनिकल मैनिफेस्टेशंस में अलग है. कम्युनिकेशंस, लेफ्ट हेमिस्फीयर्स डोमिनेट, all languages skill in the right-handed persons, and most left-handed persons may produce aphasia or dysphagia, खाना खाने निगलने में दिक्कत होती है. Involvement, expression and the compressive functions. Receptive aphasia, sounds of speech nor its meaning can be understood in spoken or in written. Expressive aphasia, difficulty in the speaking and writing, यानी बोलने में प्रॉब्लम है, साउंड भी क्लियर नहीं है और वर्टिकुलेशन भी सही नहीं है। डिसआर्थरिया, वर्ड्स का आर्टिकुलेशन प्रॉपर नहीं है, अफेक्ट द मैकेनिज्म ऑफ द स्पीच, मसल कंट्रोल डिस्टर्बेंस, सो द डिफिकल्टी इन द प्रोनाउंसिएशन, आर्टिकुलेशंस एंड फोनेशन। स्ट्रोक ब्रेन एक्सीडेंट, ब्रेन एक्सीडेंट यानी एक तरह का सेरेब्रोवास्कुलर एक्सीडेंट जिसमें सडन सिम्टम्स की पाई जाएगी, किसी की सिवियरिटी है, लेस और मोर प्रोमिनेंट में भी देयर। हेडेक, mental changes causes confusion, disorientation, memory impairment, aphasia, respiratory problems, decreased cough and swallow reflex, agnosia यानी sensory impairment may be there, incontinence, seizures, hemispheres or hemiplegia, hemiparesis, emotional lability, visual changes may be there, Horner syndrome, ptosis of the upper lid, आंखों की जो पलकें हैं ये एक तरफ से ड्रूपिंग हो जाती है, इसकी इसमें पैरालिसिस देखने को मिलेगा, टोसिस इसको कहते हैं हॉर्नर सिंड्रोम। वॉमिटिंग इज देयर, परसेप्चुअल डिफेक्ट, हाइपरटेंशन, अपरेक्सिया यानी डिक्रीज्ड ब्लड मूवमेंट में भी seen, पैरालिसिस, सेंसरी लॉस, रिफ्लेक्स चेंजेस एंड लैंग्वेज विजुअल डिस्टर्बेंसेस, दीस आर द मेन सिम्पटम। अगर टीआईए है, ट्रांजिएंट इस्केमिक अटैक, तो कंफ्यूजन, मल्टीक्यू, डिसआर्थरिया, ट्रांजिएंट हेमिपेरेसिस, टेम्परेरी विजन चेंजेस, लास्ट ए फ्यू मिनट्स टू 24 आवर्स यानी ये 24 घंटे के अंदर अंदर ठीक भी हो जाता है। बट ये सीवियरली एक वार्निंग साइन है कि यू हैव टू चेंज योर लाइफस्टाइल्स एंड सीवियर वे ले द मेडिकेशंस। ट्रीटमेंट गोल्स, प्रिवेंशन, हेल्थ, maintenance focus. If patient suffering from the transient ischemic attack or minor symptoms, so patient should aware about the rest of the life and control the diet as well as manage the lifestyle. Healthy diet should be taken by the patient, free of the high cholesterol diet or refined oil must be avoided. Weight control, very important. The diet, fried food or junk food or hotel food or like rich in refined oil, this type of food may be avoided by the as a precautionary. Weight control, it is very important because many of the patients suffering from the stroke is over weighted. If patient are having overweight, having hypertension and hypercholesteremia, these trio is very fatal. Regular exercise, if patient survive or if patient suffering from the transient ischemic attack, it suggests you have changed your lifestyle. Regular exercise is there, 4 to 5 kilometer daily walk, light warm up also advised by the doctors, and running or walking, these are the may include your lifestyle. No smoking. Smoking causes hypercoagulability of the blood and some arterial disease like Raynaud's phenomena, Burgess disease may be produced, and arthritis nodosa. Limited alcohol consumption, because liver can consume 60 to 80 ml alcohol, but if this dose is high or over consumption of the ethyl alcohol there, liver may be surrender and accumulation of the fat on other alkaloids or some radicals in the liver, and it produce hepatic failure and hepatitis and other disease. So liver is our powerhouse. If liver is damaged and less functioning, so other disease or metabolism functions may be affected. So hypercholesteremia, sugar, other disease may be developed. Root health assessment, make the chart and routine health assessment measures, adopt it and take the advice of a physician and doctor regularly, and the health statistics, vital status may be checked regularly or weekly. Control of risk factors, like risk factors, it means smoking, the passive smoking or active smoking, alcoholism, other bad habits, junk food or other habits, risk factors be avoided. Diabetes, hypertension, cigarette smoking and hypercholesteremia. If we suffering from this kind of condition, we should limit all these things and manage, adopt the healthy lifestyle. So prevention, drug therapy, surgical therapy and rehabilitation, these are main steps for the control of C.V.A. because homeopathic medicines are very useful at the time of rehabilitation, at the recovery period, after the discharge from the hospital. But very important, at first, prevention is very important step for this. Prevention, diet, regularity in your lifestyle management, drug therapy, especially after the affection of the cerebrovascular accident, surgical therapy, especially suitable at the cerebrovascular accident by the hemorrhage or rupture of the blood vessels or brain hemorrhage, rehabilitation after the recovery phase. So diagnostic study, done the confirm C.V.A. and identify the causes, neuroassessment, carotid, that is the assessment phase, carotid fluids, carotid Doppler studies, ultrasound studies, CT scan primary, identify size, location differences between the ischemic hemorrhages. It is very important. At the location site, identify the location and size of the infarct area, size of the hemorrhage, size of the clot or spot of the ischemia. CT scan angiography, visualize the vasculature. MRI, it is greater significant specify than the CT scan. It may be able to use the all patients, especially mental and claustrophobia. Angiography, gold standard for the imaging the carotid vessels, for the seeing of the atherosclerotic plaques, the foam cells, atheroma, and blockage area. Drug therapy, thrombotic, C.V.A. to re-establishment of the blood through the blocked artery, thrombolytic drugs, tissue plasminogen activator, TPA, produce the localized fibrillysing by the binding of the fibrin in the thrombi. Plasminogen converted to the plasmin, fibrolysin, enzymatic actions digest fibrin and fibrogen, result the clot lysis. This is the action of the fibrolytic factors, especially tissue plasmin activator. This type of medication may be given in injectable form to sudden dissolving of this type of thrombotic agents. Administration within the 3 ortho symptoms of the ischemic attack. If patient suffering from the ischemia, we can give this type of treatment within the 3 hours, anticoagulants, calcium channel blockers to dissolve the thrombus. Surgical treatment, carotid endarterectomy, preventive, 1 lakh in per year, removal of the atheromatous lesion. It is the treatment for repair of this atheromatous patch. Clipping, ripping, coiling of the aneurysm. If in any artery, carotid artery, circle of Willis, there is a weak point and it is protrude and bulge out, or aneurysm may be developed, because aneurysm, after the development of aneurysm, there is a chances for rupture of this aneurysm. So we can clip this, wrap this, or coiling method may be used for the repairing for this aneuritic patch, just like this stent therapy in the coronary artery. In cerebral vessels, we can coil or clip or wrap this weak point. Evaluation of the aneurysm induced hematomas larger than 3 centimeter. Treatment of the arteriovenous malformation also. Clinical goals: maintain the stable and improve the LOC, attain maximum physical functioning, attain maximum self-care activities and skills, maintain stable body functions, maximize the communication abilities, maintain adequate nutrition also, avoid complication of the stroke, maintain effective personal and family coping. So that's all about the C.V.A. In homeopathic part or homeopathic management, we can give many homeopathic medicine like camphora, carbovage, arsenic album, sickle core, many of the medicine used, but in the different stages of the shock. In the case of the hemorrhagic cerebrovascular accident, it is the acute surgical critical condition. So without wasting the time, we should transmit the patient to the emergency unit, the neurological unit, and ICCU for the treatment. If patient suffering from some kind of symptoms like paresis, hemiparesis, or transient ischemic attack, he should be warned, and remaining life, the patient change his lifestyle and diet, other medications, necessary medications also take by the patients, and give the advice, take the advice from the neurophysician and his own doctors. Some homeopathic medicines very useful for the curcuma and tinospora for act as a blood thinner and antioxidants. Very good medicine. Dept, indica, ashwagandha, tinospora, and curcuma. These are the very important medicines for the thinning of the blood and keep the blood in the solution thin form, because hypercoagulability is one of the cause of the thrombosis and formation of the stroke. So diet restrictions, mild exercises, changing the lifestyle, this is the main prevention or main treatment for the this type of condition. If patients survive from this symptom, the stroke, sometimes patient 20% and 30% physically disabled. So in that condition, we can give the homeopathic medicines for the fast recovery as well as for the blood thinning, and for remaining effect of the paralysis may be treated by the homeopathic medicines. So homeopathic medicines are very useful. Homeopathic treatment is very useful in the recovery phase of stroke and initial phase of the stroke. But if this condition is hemorrhagic, so in that condition, emergency treatment or critical care should be given to the patient. So this is all about the stroke. If you want, if any query or any question that you can ask to me. Hello, am I audible?
Sir, you are audible, sir.
If there is any question of any student, any candidate, or any participants, you can ask to me about the stroke.
Sir, thank you, sir. First of all, I would like to thank you for the wonderful session, sir. Respected participants, if you have any questions, kindly comment in the comment box so that sir will be answering. Yeah. Sir, how about the investigation we have to concentrate if a stroke patient has been appealed to the emergency unit, sir?
Actually, emergency, I told you, the hemorrhagic cause. 15% cases of the cerebrovascular accident due to the hemorrhage, sudden hemorrhage, head injury, accidental cause, fall from the bike, accident from the car, fall from the height or ceiling. At the time, worker may fall from the head injury or directly fall on the head on the floor. Sometimes direct head injury may causes brain hemorrhage, or sometimes this bleeding may be concealed. जो चोट होती है वो ब्लीडिंग को बाहर नहीं निकलने देती, तो कंसील्ड हेमरेज आर मोर डेंजरस देन द ट्रोमा और हेड इंजरी दैट कॉजेज अलाउ टू ब्लड फॉल आउट. सो इस तरह के केसेस जो होते हैं, दिस आर द अक्यूट इमरजेंसी केयर. बिकॉज एक ऐसा केस था कि ट्रेन से उतरने की कोशिश किसी ने की थी एंड ही फॉल डाउन, हेड के बल गिर गया था, लेकिन वो किसी तरह घर पहुंच गया और घर पे जाके सो गया. उसको लगा तो सही सिर भारी भारी है, कुछ पेन हो रहा है, लेकिन वो हॉस्पिटल नहीं गया, घर जाके सो गया और अगले दिन फिर वो उठा नहीं पेशेंट जो है. तो रात भर ब्लीडिंग होती रही, उसने वो अनकॉन्शियस हो गया और उसको कोई हॉस्पिटल भी नहीं ले गया. तो अगर ऐसा कोई केस दिखता है आसपास हेमरेज का, हेड इंजरी वाला, और कुछ नोजिया, वोमिटिंग, कुछ ऐसे सिम्टम्स आ रहे हैं, तो वी शुड टेक पेशेंट टू द इंटेंसिव केयर यूनिट, इमरजेंसी केयर और क्रिटिकल केयर यूनिट, or without wasting the time and giving to the patient. If patient suffering from the any gradual cause it means ischemic cause, any thrombotic or any other cause, so in that condition we can give the homeopathic medicines, another mode of the medications, because this is the condition, maybe this is not emergency, because transient symptoms is there, very gradual development of the symptoms of the stroke. Okay. So with your conscious and with your intelligence, the sign symptoms, we can ask the patient. मैंने आपको 3 साइन बताए ना पेशेंट को, कि पेशेंट को हम एक वर्ड बोलने के लिए कहेंगे, ठीक है ना, हम पेशेंट को एक हैंड रेज करने के लिए बोलेंगे, ठीक है ना, हम पेशेंट को कहेंगे कोई एक सेंटेंस को पूरा बोल के दिखाओ, वो नहीं बोल पाएगा, और पेशेंट को कहेंगे अपनी टंग को बाहर निकालो, प्रोट्रूड करो टंग, वो अपनी टंग को प्रोट्रूड नहीं कर पाएगा और हंस नहीं पाएगा. These are the sign symptoms we can recognize in the stroke patient. Any other question?
Thank you, sir. Any other question from the participants?
Any other question?
Sir, what's the type of the CPR BLS support if you are supposed to conduct the awareness program? अगर किसी को समझाना है तो how we can manage such things, sir?
सीपीआर प्रोग्राम ये कार्डियो पल्मोनरी रिससिटेशन के लिए होता है। स्ट्रोक के केस में इसका इतना इंपॉर्टेंस नहीं है, ठीक है ना। स्ट्रोक का केस है, इट इज कंप्लीटली ब्रेन इन्वॉल्व, ठीक है ना। जैसे आपका हार्ट अटैक है, हार्ट इन्वॉल्व है, स्ट्रोक के केस में ब्रेन इन्वॉल्व है, ठीक है ना। तो सीपीआर का इसमें इतना इंपॉर्टेंट रोल नहीं है, बिकॉज ब्रेन इज डेड। ब्रेन का जो हिस्सा है उसको सप्लाई नहीं मिल रही, वो डेड हो रहा है। ब्रेन में कोई हेमरेज है, वो प्रेशर प्रोड्यूस कर रहा है, तो ब्रेन डेड हो रहा है। तो सीपीआर से इसमें ज्यादा कोई बेनिफिट नहीं होगा, ठीक है ना। हमको इसको इंटेंसिव केयर यूनिट में देना है, थ्रोम्बोलाइटिक ट्रीटमेंट देना है, या फिर उस हेमेटोमा को रिमूव करना है सर्जिकली, या कोई थेरेपी देनी है, तो उसमें से हॉस्पिटल ले जाना पड़ेगा। इट डिपेंड्स ऑन द सिवियरिटी ऑफ द केस।
Yes, sir.
Any other question?
Yes, sir. There is a question from the participant, sir. Sir, can stroke be a chronic case? This is their question, sir.
Chronic case, ischemic cause may be chronic. There is a recurrent warning signs of transient ischemic attack is there. Sometimes it lasts for the few seconds. Next time it lasts for few minutes. कभी कभी आया, कुछ घंटों के लिए आया, लेकिन पेशेंट ने अपनी लाइफस्टाइल को चेंज नहीं किया. It doesn't improve its lifestyle. It doesn't change its diet or continues suffering from the hypercholesteremia, diabetes, hypertension. तो एक समय ऐसा आएगा कि स्ट्रोक ग्रेजुअल सिम्टम्स एकदम से सडन हो जाएगा. कभी कभी उसको नमनेस हुआ, कभी ना कभी उसको लगा हल्का यार पैर कभी लकवा टाइप का लग रहा है, पैरालिसिस लग रहा है, तो उसको मसाज दिया जाएगा, वो ठीक हो गया. तो आगे 10-15-20 दिन निकल गए. तो दिस टाइप ऑफ वार्निंग साइंस आर वेरी इंपॉर्टेंट. वी शुड नोट द सिम्टम्स एंड अकॉर्डिंग टू दिस वी चेंज आवर लाइफस्टाइल एंड डाइट पैटर्न आल्सो. नहीं होगा तो ये ग्रेजुअली हो, ये क्रॉनिक ही होता है. जो इस्चेमिक अटैक है ये क्रॉनिक है. 85% केस में ये क्रॉनिक होता है, ठीक है ना. लेकिन सिम्टम्स एसिम्प्टोमेटिक हो सकते हैं. सिम्टम्स आते हैं, सबसाइड हो जाते हैं. सिम्टम्स ट्रांजिएंट होते हैं, पेशेंट की लाइफस्टाइल चलती रहती है. लेकिन एक समय ऐसा आता है, अब कोई हार्ट अटैक आया मान लो किसी को, तो हार्ट अटैक तो सडन ही आया, लेकिन कोई एक दिन में 90% 100% आर्टरी थोड़ी ब्लॉक होगी. धीरे धीरे ग्रेजुअली डेवलप होती है, ठीक है ना. अक्यूट जो कार्डियक अरेस्ट कहते हैं ना, वो इसलिए कहते हैं कि उसमें सडन वेसोस्पाज्म आया, उसमें ऐसा नहीं था. लेकिन जो हार्ट अटैक आता है उसके अंदर आपका आर्टरी पहले से 90-100% ब्लॉक होता है. तो ऐसे ही ब्रेन में भी कॉर्नरी वेसल्स जो आपकी जो वेसल्स हैं ब्रेन की, सेरेब्रल वेसल्स, ये ब्लॉक्ड है पहले से. 50%, 60%, 70%, 80% होती है. धीरे धीरे फिर साइन सिम्टम्स आते हैं, साइन सिम्टम्स सीवियर होते जाते हैं. फिर एक समय ऐसा आता है कि पेशेंट को सीधा ही पैरालिसिस का अटैक. Any other question?
Thank you, sir. Any other question from the participants? They can comment in the comment box so that sir will be answering actually.
Questions about? It's all?
Yes, sir. I hope they were clear with the topic also, sir.
Yes.
Yes, we will give a one more final question. Any other questions from the participant? So that we will wrap up the session. Sir. So thank you, sir. Thank you so much for this wonderful session and clearing all the doubts also. And here we have discussed regarding right from the introduction, its management and its physiology, everything we have discussed, sir. Thank you, sir. Thank you so much for the detailed description of the topic. And thank you all the participants for your active participation. And so as you all know, the Sunday there will be a session of Dr. Nagendra Babu, sir. So I hope it will be a great success and make use of it. And sir will be taking a good topic. So hope you all will be present over there. So thank you all. Thank you, sir. Thank you so much.
Thank you.
Thank you so much, sir.